So hi good people, today we'll be focusing on endocrine disorders. We'll be doing some sort of MCQs. We are focusing on Diabetic Ketoacidosis and HHNS. So the first question reads, this complication is found mainly in type 2 diabetes. So we need to know for type 1, the main complication is always DKA, and for type 2 it always HHNS. 2, it talks of a patient is found to have a blood glucose of 375 grams per deciliter, positive ketones in the urine, and a blood pH of 7.25. What condition is this? So from the things that we have been given, we look at the positive ketones in urines. 2, we talk about the blood pH, of which it's 7.5. That's slightly acidosis. Then the blood glucose levels, they are 375. So at this point we can say, what's the answer? That one I will not give you. You will try, then you will put it down in the comment section. 3, it talks of hyperglycemic, hyperosmolar Nonketotic syndrome. Will have all the following signs except. So for HHNS, there are key signs. So they want us to differentiate the ones that are not part of it. 1, it talks of dry mucous membranes. 2, it talks of polyuria. 3, it talks of blood glucose of more than 600. Then 4, it talks of Kussmaul breathing. So at this point we are confident to say dry mucus will be there, polyuria will be there, blood glucose levels of more than 600 milligrams per deciliter will always be there. But for Kussmaul breathing is mainly found in DKA because it's always acute, and at this point the respiratory system is trying to compensate the metabolic acidosis that has always been there. Then we need to know for the HHS, it's always chronic, so it takes a long period of time. The onset is always at a slower rate compared to DKA. So blood glucose levels, we expect them to be more than 600 as the way it's listed over there. The next question says, a patient has an infection and reports not checking their blood glucose or regularly taking Metformin. What condition is this patient most at risk for? So the clue things that we can find from this question, let me put some pen. We are told about this aspect of Metformin. So at this point we are thinking of type 2, not type 1. Then has an infection, then reports not checking their blood glucose levels or regularly taking this Metformin. So what condition is the patient most likely at risk for? So since we already have this aspect of taking type 2, of taking Metformin, and we know it's mainly for type 2 diabetes, so we always at risk of developing HHNS, not DKA, because DKA we've said is mainly for type 1. So then we also talked about DKA. We'll also find the aspect of metabolic acidosis in DKA. So since the question has already told us about Metformin, at this point you are confident to say that answer B is not the right answer. Next, talks about which patient population is most at risk for developing diabetic ketoacidosis. Always remember, once you see this aspect of DKA, think of type 1. And we've always said type 1 always affects mainly the young people. So we can come back to our answers. It talks of newly diagnosed diabetes. So at this point we are thinking of what? For newly diagnosed, it can either be type 1 or type 2 DM. 2, it talks of middle-aged adults who are obese. At this point here, the aspect of obesity and sedentary lifestyle, where we are just consuming mainly more carbs, but we are not doing any sort of activity. It's mainly sedentary lifestyle. Then they are talking about middle age. So at this point, you're also thinking of this should be type 1. Then older adults with type, we've already been given this aspect of type 2. So we roll this out. It's mainly in type 2. Then none of the options. Of course, we have one of the options, of which is always a boy. So the patient population at risk of this aspect of DKA, we are thinking of middle-aged adults who are obese. I hope we are at par. Next reads true or false. Osmotic diuresis is present in HHNS and DKA due to the kidney's inability to reabsorb excess glucose, which causes glucose to leak into the urine, in turn causes extra water and electrolytes to be excreted. At this point, this is always right, because we're always saying there's always that aspect of hyperosmolarity in the blood glucose level. So the kidney tries to excrete more sugars through urine, trying to correct this issue. So at this point, we are confident to say that the answer is true. Next talks about which of the following is not a medical treatment for DKA and HHNS. Which is not a medical treatment? Which is not a medical treatment? 1, it talks of regular insulin. 2, it talks of isotonic. 3, it talks of bicarbonate. 4, it talks of sodium potassium solution. Sodium potassium solution. So at this point, we need to think, because we've said for both DKA and HHNS, there's that aspect of hyperosmolarity in the blood glucose levels. So this means that we are not having sugars into the cells, of which for both will give this regular insulin, of which that is right. 2, because the kidneys are trying to balance the sugars by excreting more water, so we need to do some sort of rehydration in both. So we'll give the isotonic, it's there. 3, we've said that the kidney is trying to excrete more sugars through the urine. At this point, we also at risk of some electrolytes imbalance. To be specific, we always talk of potassium solution, so that is also part of it. So we're only remaining with the bicarbonate. So when you talk about bicarbonate, it's mainly specific with diabetic ketoacidosis, because we talked about the aspect of the liver trying to compensate by burning the lipids that were stored, and that process of lipid metabolism, it always yields to the energy. We can talk of ATP, but there's always ketones which are always acidic in nature. So these ketones will always bring about that aspect of metabolic acidosis. So the system will always another system tries to pick up by compensating that aspect of metabolic acidosis, trying to correct it, and the patient will always present with Kussmaul breathing. So for DKA, we do the bicarbonate, and also let us remember it's always acute in onset, unlike the other one which it's always gradual, it takes a long period of time. So the one that is not a medical treatment for both the two conditions, we are confident to go with bicarbonate, because we've said it's specific to DKA. Next reads, which one of the following is not a sign or a symptom of diabetic ketoacidosis? It's not a sign or a symptom of diabetic ketoacidosis. It's not a sign or a symptom. 1, we talk of positive ketones in the urine. 2, it talks of oliguria. 3, it talks of polydyspia. Then 4, it talks of pelvic pain, abdominal pain, sorry. So we need to remember that in case the body is unable to put sugars into the cells, it means we are having too much sugars into the blood, the hyperosmolarity. So the kidney will try to compensate by excreting more water. So as it releases more water, we're having the aspect of polyuria, so we're having too much urine. 2, as the urine leaves the body, the patient is always predisposed to dehydration. 3, we've talked about, because now we are not having any sugars reaching the cells, and the cells need energy. So the liver comes, starts burning the fats to release ketones. So ketones into the bloodstream, they are the things that will bring about the aspect of things like metabolic acidosis. So positive ketones in the urine, that's a plus. Then we also talk of severe abdominal pain is always there. Then let us remember, I've lost a lot of water. Now you need to drink more water. So these people always present with polydyspia. They need to drink more water. Abdominal pain is there. Then positive ketones in the urine. But oliguria, that is not a sign or a symptom of diabetes ketoacidosis. Next, it reads, you are providing care to a patient experiencing diabetes ketoacidosis. The patient is on insulin drip and their current glucose level is 300. In addition to the insulin drip, the patient also has 50% dextrose, 0.45 NS infusing on the right vein. Which of the following patient signs and symptoms causes concern? So the question, ideally it has brought out clearly how we manage. 1, we are looking at we do insulin drip, we do some sort of infusion, because we don't want also to lower the sugar levels down at a faster rate. We need to titrate it so well. That's why also this patient is also on glucose, dextrose 5% D5. Then normal saline 0.445, because we talked of the aspect of dehydration, so we need to rehydrate. That's always a priority action. So it says, which one of the following patient signs and symptoms causes a concern? What will cause a concern for you? 1, a patient has a potassium levels of 2.3. 2, patient complains of thirst. 3, patient is nauseous. 4, patient's skin and mucous membranes are dry. So at this point, if we try to check the answers, when you look at the patient skin and mucous membranes are dry, the patient complains of thirst, all these are always signs and symptoms of this DKA, because it causes, we can talk of things, mainly it's the dehydration, so we are expecting this. Then the patient is always nauseated. We are thinking of the ketones. It brings that aspect of that aspect of nausea. Sorry, I can't type that fast, but that is mainly ketones. Then A reads of the patient has a potassium levels of 2.3. Ideally, these are too low, because the normal levels are always 3.5 to 5.0. So if it's lower than this, we are thinking of hypokalemia. Arrhythmias might start kicking in, and even the heart might fail, and this might endanger the patient's life. So a patient potassium levels of 2.3, it's always a concern. Like the patient feeling thirst, dehydration is there, that's why we are giving, we are infusing normal saline 0.4%. The patient is nauseous. Those are the effects of ketones. That's why we are giving insulin to try correct that issue. Then the patient's skin and mucous membranes are dry. We always expect that because of also the aspect of dehydration. That's why we are trying to correct it using 0.45% normal saline infusion. So up to this point, we've tried to cover 10 questions of both the two conditions. Let's finish with the last one. It says, a patient is being discharged home after recovering from HHNS. Which statement by the patient requires patient re-education about this condition? 1, I will monitor my blood glucose levels regularly. Of course, that has to be there. 2, it talks of the condition happens suddenly without any warning sign. remember we talked of HHNS, and we said it's always gradual in onset, unlike DKA. So we cannot say this condition happens suddenly. It's always there is that aspect of onset. So the only thing that makes us to disqualify this answer, they are saying sudden. It's not suddenly. If it were for diabetic ketoacidosis, then we'll have talk of it happens suddenly. But you can also look here without any warning signs. These results mainly removes this answer. Then C, it says if I become sick, I will monitor my blood glucose more frequently and will drink lots of water. Is because of that aspect of infection, and it always affects also the insulin levels. Then D, it's important to take my medication at prescribe. Of course, they have to take. It's type 2 diabetes, they'll always be on metformin and other drugs that try to correct this issue. So up to this point, we've covered diabetic ketoacidosis and the hyperosmolar and Nonketotic syndrome. Those are the answers. So for the next part, we'll be looking at now the NCLEX questions. Mainly we'll be focusing on the hyperglycemic, hyperosmolar and Nonketotic syndrome, and also we'll also do some NCLEX questions about DKA. So probably you can follow for more. Thank you.